With the cholera outbreak in Hammanskraal and surrounding areas in Gauteng, we'll talk now to Tshwane Executive Mayor Cilliers Brink. He joins us via Zoom. Executive Mayor, good morning to you. Thank you so much for giving us your time. Mayor, are you able to hear me?
Good morning, good to be with you.
Okay, there's your sound. Okay, thank you so much for giving us your time. I mean, I want to start with, we know that it was Sunday when the city released that alert, letting people know in areas in Hammanskraal and in surrounding areas not to drink the water and that the water was not safe. But when exactly did you know that you might very well have a cholera outbreak and that the situation and the water quality in that area was simply subpar?
So the city, as far back as August 2021, made it clear that the water in the area is not potable, and so water tankers have been provided both to formal and informal settlements on a regular basis for a number of years. So that doesn't mean that there was necessarily a detection of cholera proactively in the water. It simply meant that due to the issues that we have at Rooiwal Wastewater Treatment Plant, where water is treated and then goes downstream to Temba Water Works, is not suitable for human consumption, and that's why those measures were taken. On Friday, there was an indication, late on Friday, that there were instances of diarrheal disease, but the confirmation of the tests at Jubilee Hospital that this is in fact cholera was only obtained on Sunday.
Okay, Mayor, that's obviously now you're speaking about the tests that were conducted on the patients that presented at Jubilee Hospital. Let's talk a little bit about the water. Absolutely. Let's talk a little bit about the quality of water in the area. When last was the water in the area tested and treated, to your knowledge?
So regular routine tests are done on water streams, on supply areas on a monthly basis, in fact, and none of those tests indicated a positive case of cholera or typhoid or any of the diseases that present a threat to human life. That, however, does not mean that we have conclusively determined the source of this. This could be a source of city water. It could be another source. But even more rigorous tests and more tests on various sources are being done, and we're awaiting the results of those tests. But just to be clear, the city did not proactively, through our environmental health tests that are done on streams, on water supplies, detect any cases of cholera before this broke out.
Not necessarily cholera, of course, but we've known for many years that the water in the area has been problematic. I mean, we can go all the way back to 2019 when the South African Human Rights Commission also declared the water in Hammanskraal water that could not be consumed by the citizens in the area. So since that declaration in 2019 by the South African Human Rights Commission that there is a serious water crisis in the Hammanskraal area, what has the city done? I mean, surely, even as you step in as executive mayor of the city, one of the things you're going to look at is the basic human rights of citizens in the city to ensure that they are being protected.
Absolutely. So I mentioned the water tankers that were provided, that has been provided on a daily basis to the affected areas. But we have to admit that successive administrations in the city of Tshwane have failed the people of Hammanskraal in respect of that wastewater treatment plant. Even last week, as I did my State of the City, I described Rooiwal as a stain on the conscience of the city. We have to admit that by our own resources, we are unable to solve the problem there. And that's why I've met with the Minister of Water, and why I've said that the city will have to cooperate with other spheres of government as well as the private sector to get the necessary capital to upgrade the Rooiwal wastewater treatment plant. Now, admitting that and being clear and candid about that does not solve the problem, but it is an essential first step in solving the problem. And in the meantime, the only thing the city can do is to provide those water tankers and to check that they are actually doing the work that they've been contracted for.
Who does the families of the 12 people that have lost their lives, including a 3-year-old, who do they point the blame at?
So obviously, we haven't had any interrogation of who they point the blame at. Our first response is to express condolences to those families. The second response is to actually determine what the source of the cholera is, because unless we have conclusive tests that point to the source of the cholera, pointing fingers is only going to delay in actually getting to the bottom of this and managing the situation.
What do you say to the view that in the city of Tshwane, one of the biggest challenges has been the leadership squabbles, the coalition troubles that the city has had, the changing leadership constantly, that there is a view perhaps that some may say, well, that's where the leadership is focused on, is, the changing of seats in council and not focusing on service delivery of the people. What do you say to that view?
So that can certainly be a criticism of the city. I think if you dig deeper into what happened in regards to Rooiwal, there's also been irregular tenders that were awarded in that instance. Again, in those instances, I've been very candid about the situation. We have to look into that. The first phase of the upgrading of the Rooiwal wastewater treatment plant was meant to be complete already, but the contractor walked off site. There was irregularities with appointments. And so it is more than just political instability, but to convey confidence to the people that this problem will be solved, that will require certainly very strong and decisive leadership, which we hope to give in the coming weeks, to give assurance that despite all of the delays, despite the failures, that different spheres of government will work together, that will deploy resources from the private sector if necessary, and that once and for all the people of Hammanskraal will have a conclusive answer as to the way forward.
Mr. Mayor, I'm hearing now that the death toll has risen now to 13. Have you got confirmation of that?
I wouldn't want to confirm that by myself. I would first want to consult the Gauteng Department of Health, who is at the center of managing the health situation. But if you have confirmation from them directly, I would trust that indication.
Just what the message is right now for some of the citizens then that are living in Hammanskraal. I mean, you're saying we're bringing in the water tankers. How sustainable is that going to be? And how long are they going to live like this, being afraid to open their own taps?
So to be clear, the water tankers aren't just deployed now. They have been deployed for months. The warning that the water in the area of the Tembo waterworks is not potable has been given years ago and has been repeated. And we want to reiterate that before using water from the taps in these areas, the water has to be treated. It is not suitable for human consumption or cooking of food as is. We want to please emphasize this message, as well as the importance of cleaning any water tanks or water receptacles with household bleach before they're used again. Also, personal hygiene, the washing of hands, is crucially important to stopping the spread of cholera. Our first priority is to contain the situation, to determine the source of the cholera outbreak, and then to take every possible step to prevent spreading of the disease, but also a loss of human life. Lastly, if anybody presents with diarrheal disease in this area, please go to a healthcare facility as soon as possible. I am informed that many of the deaths that have occurred have been in part due to the fact that patients presented so very late to healthcare practitioners. Lives can be saved by early treatment of this condition.
And do you at all consider this a failure by the democratic alliances governing of the city of Tshwane?
So, as I said, we must first determine the cause of the cholera. I have been quite candid about the situation around Rooiwal and the wastewater treatment plant. It has been a failure by successive administrations, including the coalition that is currently in government. We can't hide from that fact. We can't deny it. Being clear and candid about that failure is the first step to actually solving the problem. So in response to your question, yes, of course. The question now is, what do we do to take responsibility for improving the situation.
I want to go back to Friday, the 29th of October, 2021. The Minister of Water and Sanitation, Senzo Mchunu, said the Department of Water and Sanitation would seek legal advice from the department's legal services with regards to the recommendation by the Human Rights Commission to take over from the City of Tshwane Metro Council the responsibility of resolving water and sanitation services in Hammanskraal. I mean, is this a concern for you that you might have the responsibility of service delivery of a basic service in the city of Tshwane being handed over to national government because the city simply cannot handle the responsibility?
So listen, wastewater treatment isn't in fact a common local government competency. In most instances, it's national government that takes responsibility for wastewater treatment. But as I've said to you over and over again, this is a failure. This is a stain on the conscience of successive administrations. If you're looking for a denial of the problem, you're certainly not getting it from me. Last week, I met with Minister Mchunu. We discussed the extent of the problem. We agreed to meet with our technical teams within the next 2 weeks, and all possible solutions are on the table. Whether that involves handing over certain of the responsibilities to national government, going into a partnership, looking to the private sector, the point is, whatever has been done up until this point has not worked. The people are running out of patience. We need to solve the problem in a quicker time frame than the city of Tshwane can with the resources at our disposal. To give you an idea, the second phase of the upgrade of the Rooival wastewater treatment plant is going to cost 2.5 billion rand. That is the entirety of the city's capital budget for any one financial year. So we have to be clear, we have to be humble, we have to say whatever works must now be undertaken, and that's why I look forward to my engagements with the minister, which was agreed upon even before this present crisis.
All right, thank you so much for speaking to us. That there, Executive Mayor of Tshwane, Mr. Cilliers Brink.